So as one of the POCUS fellows this year, I've seen a lot of rotators come through the rotation, and I thought I would do a short segment to tell you a little bit more about the rotation and to tell you why you should come to SickKids to do this rotation. So first, who is the POCUS SickKids rotation for? Actually, it's for everyone. This year, we've had trainees from medical student to well-established physician working in different settings. We've had a lot of PEM fellows coming through, but we also had a few physicians coming from the intensive care unit, from the emergency department, across the planet. So I really think this rotation is for everyone. There's different ways to do the rotation. First, there's a 1-month elective, which I think is a great way to start familiarizing yourself with POCUS. Second, there's a lot of trainerships that can be done that are often chosen by well-established physicians, and they can range from 1 month to a couple of months afterwards. So what will you learn when you come to POCUS? So in general, I have to say that most rotators will become quite familiar with the basic of ultrasound physics and knobology. They will certainly gain a lot of exposure to certain applications such as cardiac, lungs, fast, and ocular. If you spend 4 weeks and you work hard during the rotation, you'll also get familiar with the most advanced application of POCUS, including things such as the abdomen, the skin and soft tissue, the head and neck, and more. What does the rotation entail? So we have a standard format for our rotation, where at the beginning of the rotation, you'll be rotating with 2 or 3 of the POCUS fellows, and you'll learn the way the rotation works and how the scanning shift works. And you also get to scan and become more comfortable with the basic application of POCUS. Once you become more comfortable, usually around the 2-week mark, you get to scan with different faculty that have an established practice, and you come shadow staff during their clinical shifts. So that really helps you integrate what you've learned about POCUS during your rotation here and be able to apply it clinically. During the month, there's also a lot of academic opportunities. You get to come to weekly rounds. There's also often during the PEM departmental rounds a lot of POCUS that is being done. I personally find that it's actually a good way for those of you who have an interest in POCUS to come and familiarize yourself with this world. You'll get to know people who have a lot of experience in this discipline and also familiarize yourself with the network, with all of the resources. So it's really a good starting point for anyone who wants to develop an expertise in point of care ultrasound. If you're interested, you can always look on our P2SK website for more information. If you like this video today, please subscribe to our channel.